So in nursing school, we teach you where to put the stethoscope for placements, listening to heart and lung sounds. However, you're not sure sometimes what you're listening to. So I covered in my nursing notebook, but listen to these sounds here and what you're going to be hearing when you hear abnormal lung sounds.
Let's go ahead and jump right into abnormal breath sounds. And we're going to talk about rhonchi first because this is what most people go to. They either document scattered rhonchi or just rhonchi. And you're not wrong if you probably do this because they probably do have some rhonchi, because you see it in patients with COPD and also anybody that's fluid overloaded, cystic fibrosis, heart failure. Sometimes this happens when you get a lot of mucus in your large airway, best heard over your trachea and over your right and left main stem bronchi. So this will be more of a bronchial or bronchial vesicular sound. It's not going to be necessarily in a vesicular sound because now we've moved out of the large airway. So people say it also sounds like snoring, and this is what it sounds like. The thing is with rhonchi is that you can clear it, and you can clear it with a cough, or you can suction it out. Now let's move on to crackles and rales. So this one is kind of interchangeable. You can use this when you document because rales are considered a little bit more like fine crackles. So mostly crackles are defined as fine, coarse. They can be dry or moist, and it can sound like fire crackling. It also can sound like a rocks being moved around, people with pulmonary edema, asthma, heart failure. Again, this is a lot of things with fluid. This is high-pitched sounds, and it's the air trying to move in the alveoli, and it's trying to overcome that air because it's filled with mucus or it's surrounded by a lot of mucus. So this is what crackles sound like. And let's now go into wheezes. Wheezes seem to be, I think, my favorite because they are high-pitched musical sounds, and they do sound like a high-pitched musical sound. This is heard when a sound is trying to move through a narrow airway. I really like to hear this when I'm listening to my asthma patients because it does remind me that their bronchioles are constricting, and it's hard for them to move airway out. So sometimes you hear it a lot on the expiration. You can hear wheezing on inspiration, but a lot of times you're going to hear it on the expiration. These are tight, narrow airways. Again, this is not typically to do with fluid and to do with your alveoli with a lot of mucus that you will see with the rales and the rhonchi, like pneumonia. This is the tight bronchitis, asthma, your emphysema patients, tight airway. So again, this is what wheezing sounds like. And you can hear it mostly through the exhale. And whenever you give a medication like a corticosteroid, and then you go and listen to them afterwards, or you give them a bronchodilator, it is very interesting to go and reassess them. And they typically, the wheezing can be gone. So listen to your patients before and after. This is a good way to assess that if your interventions were effective. Now, stridor's a little different. You can hear this with kids, or you can also hear this with adults, especially if you extubate somebody, which is meaning pulling the an endotracheal tube out because their airway can close off or narrow. And this is also when food gets stuck in your throat, and your epiglottitis when you have a narrowing of the epiglottis. So this is a very high-pitched sound. It sounds like your airway is narrowing and you cannot breathe. This is a medical emergency and it has to be treated immediately. This is what it sounds like. I hope that makes sense, and that is the end of this little session, and I hope that you have happy listening.